Hello, my name is Sarah Ferrante, and this is my presentation for the population level health education intervention. The health-related issues of biggest concern in Santa Maria include chronic kidney disease, diabetes, heart disease, and substance and alcohol use. Chronic kidney disease is described as a reduction in kidney function resulting in a decreased ability to filter blood and excrete waste. Signs and symptoms include changes in urination frequency, fatigue, nausea, vomiting, muscle cramps, fluid retention, shortness of breath, hypertension, and abnormal lab values for electrolytes, BUN, and creatinine. The dangerous thing about CKD is the signs and symptoms may not be apparent until later stages of the disease, and people are often unaware until stage 3. Diabetes can be described as a loss of insulin production or increase in insulin resistance, resulting in high blood glucose levels. Signs and symptoms include the 3 Ps: polyuria, frequent urination; polydipsia, increased thirst; and polyphagia, increased appetite, as well as fatigue, trouble concentrating, and an A1C above 7 points. Heart disease is a broad term used to describe conditions related to a decrease in cardiovascular function of the heart or vessels. Signs and symptoms vary, but can include fatigue, shortness of breath, chest pain, fluid retention, palpitations, dizziness, and syncope. Conditions of heart disease include heart failure, heart attack, and stroke. Finally, substance abuse involves the use of illicit drugs such as heroin, meth, or cocaine, recreational use of prescription drugs, and overuse of alcohol. It can have negative health effects, including liver damage, kidney damage, mental status changes, and heart damage, and even death. Due to the high incidence of hospitalizations related to CKD, diabetes, heart disease, and substance abuse, evaluating the community to determine contributing factors would be beneficial. We're also seeing an increase in hospitalizations due to the complications related to the identified health issues. With CKD, we're seeing electrolyte imbalance, cardiac disturbances, and fluid overload. With diabetes, we're seeing foot ulcers, cellulitis, sepsis, and diabetic ketoacidosis. For heart disease, we're seeing fluid overload, angina, MI, stroke, and heart failure. For substance and alcohol use, we're seeing an increase in fractures due to falls, encephalopathy, cirrhosis, Hep B and C, and liver failure. And we're also seeing death. Heart disease is the #1 cause of death in Santa Barbara County, accounting for approximately 1,000 deaths in 2015. Diabetes is listed as the root cause of approximately 150 deaths in 2015. Deaths related to substance and alcohol use is difficult to determine, but can contribute to deaths by falls, motor vehicle accidents, and suicide. Accidental overdoses occurred in approximately 16 out of 100 people between 2011 and 2016. Moving forward, I'm going to assess the contributing factors such as obesity for these health conditions, and want to identify the barriers that prevent the community from meeting their health goals. Healthy People 2020. For each of the 4 health concerns facing the low-income population, I chose 2 objectives from Healthy People to focus on as a part of my health education plan. The first is chronic kidney disease. Healthy People's goal is to reduce the number of new diagnoses as well as reduce complications, disability, death, and economic costs for those with CKD. The objectives I'm focusing on are reduction in the incidence of hypertension in those with CKD and a reduction in deaths of those with end-stage renal disease. For diabetes, the Healthy People 2020 goal is to reduce the burden of the disease and improve the quality of life for those with and at risk for diabetes. The objectives I'm focusing on are an increase in self-monitoring of blood glucose levels and prevention and management education. The goal for cardiovascular disease involves prevention, decreased incidence, reduction in risk factors, reduction in complications, reduction in death, and improved quality of life for those affected. The objectives I'm focusing on are a reduction in the number of those with uncontrolled hypertension and a reduction in risk factors contributing to heart disease, such as obesity, smoking, and activity level. Finally, the Healthy People goal for substance and alcohol use is a reduction in the overall use of the substances and to maintain a healthy, safe, and quality of life, especially for children. The objectives I'm going to focus on include increasing the number of adolescents who do not use substances or alcohol, and to educate on the risks associated with alcohol and substance use. The needs assessment, education, nutrition, signs and symptoms of the identified chronic health care issues, medication and treatment compliance, and prevention, risk factors associated with chronic substance and alcohol use. With the medication and treatment compliance specifically, I would want to talk about blood pressure medications, insulin, and other anti-diabetic medications, as well as checking blood pressure and glucose levels as recommended, and receiving dialysis as scheduled. For prevention, I'll focus on nutrition, exercise, smoking cessation, and maintaining a healthy weight, which are all risk factors for these conditions: heart disease, diabetes, and CKD. Substance and alcohol use are risk factors associated with liver damage, kidney failure, and encephalopathy, which can lead to brain damage. I was determined the basis of these needs on my interviews with my key stakeholders and members of the community, which included several local nurses, a police officer, staff at a local homeless shelter and food kitchen. And I talked with a lot of local members of the community. Aside from education, we'd also want to focus on resource management, which includes identifying community resources to meet nutritional needs, such as food kitchens, WIC and SNAP, taxi voucher service for doctor appointments and treatments like dialysis, mail delivery for medications and supplies, options for home health, and community-based recovery resources such as AA, NA, and inpatient rehab. With resource management, the main goal would be to assist the community members with locating these resources, to help with nutritional intake, medical treatment, compliance, and recovery. The Precede-Proceed framework, phase 1, the social community assessment, defining the ultimate outcome. It was determined that the appropriate outcome for this community would be to improve nutritional intake as a preventative measure against chronic illness. In phase 2, it was the epidemiologic assessment and identifying the issue. Identifying the issue was related to poor nutritional intake, including access, income, and lack of health education. Phase 3, the behavioral and environmental assessment, assessing that the behavior and environmental factors that needed to be in place to achieve the outcome, such as which community programs, resources, is the population actually seeking medical care, and what are the individual's desires to change. Phase 4, the educational and ecological assessment, consists of assessing the policies and administrative processes that could interfere with the interventions, such as privacy issues, background checks, and the credentials required for volunteers and paid staff members. Phase 5, implementation, involves the actual arrangement and conduction of these classes, and it'll be discussed at length later in this presentation. I will also discuss phases 6 through 7, which involve evaluation later in this presentation. Issues. Potential barriers for meeting our goals included education level. 8th grade level was common among adults. Language and culture 70% Hispanic population, many only Spanish speaking, with a different worldview perspective on health and healing. Socioeconomic, lack of transportation, low income, lack of insurance. Compliance, which is often related to lack of transportation, low income, or lack of insurance, but also cultural beliefs is also related to the non-compliance. The assets of the community are that we have several resources in place for this population, such as home health, community classes, and clinics. The demand is high for the area, but the availability seems adequate based on my discussions with the different stakeholders and nurses. The challenge remains to be the poor compliance related to the barriers discussed. Education is the key intervention to achieve the long-term outcome for this population. By focusing on teaching children good eating habits and other ways to avoid obesity, which is a risk factor for 3 of the 4 health issues identified, we are meeting the prevention and management objectives for Healthy People 2020. Additionally, by educating this population, we have a better chance of making an impact on their future decisions, which can reduce the number of new cases of these health issues, which is another objective of Healthy People 2020. Healthy People 2020, the main 3 things are prevention, management, and reduction in new cases. I was targeting the school-age population, ages 5 through 12. I utilized interactive games, visual aids, and exercise activities and snacks. I focused on interactive games so that I could keep the children engaged. We played Hangman on a whiteboard. We played Name That Fruit with flashcards, and I utilized a computer game to allow the children to create their own meals with the USDA My Food Plate website. I also handed out My Food Plate coloring pages that I got from the website. And we started the whole first session with fresh fruit that I brought, apples, oranges, and grapes. The second session was focused on disease prevention, and we played similar games, but this time outlined foods to avoid. Plus, we talked about exercises that the kids could engage in for 30 minutes each day. And I wanted to make sure I highlighted that the prevention of obesity was why we wanted to do this, because it's the common risk factor of these health issues. We ended that session with some jumping jacks and jump rope time, which the children voted on from an activity list that we compiled during the session itself. In addition, I got some tools and resources for the parents as well. I picked up some flyers and pamphlets from local community classes on nutrition, and contact information for social services regarding resources such as WIC and SNAP. Budget and logistics. The budget for my initial intervention was small. I got the pamphlets and other things from the local hospital and social service agencies. The classes are taught by nurses who are paid, but the classes are free to the community. So long term, it's going to be difficult to estimate what the budget's going to be, because we need home health nurses, we need case management, we need community clinics, we need transportation vouchers, we need mail order medications and supplies. So the majority of the cost is going to fall on the participating agencies as well as state-issued insurance providers. And it's difficult to estimate what all that's going to cost. Evaluation outcome management. So for phase 6, the process evaluation, the goal was to conduct 2 separate teaching sessions on nutrition and disease prevention. The goal was met within the stated time frame. For the impact evaluation, I'm not going to read them all, but here's the 8 short-term objectives that were identified for the population, and each of those were satisfied within the expected time frame of the teaching session itself. These goals were measured with a Q&A session at the end of each session, as well as like an identification with the flashcards. And finally, the outcome evaluation of the two outcomes I had for long-term, which was children living at or below the poverty level will increase their daily consumption of fruits and vegetables within 3 months' time, and children living at or below poverty level will improve and maintain a healthy weight status within 1 year. I thought we could measure this with a survey of the children's current weights to be measured, and then follow up within 3 to 6 months. And then as well as we could interview the kids in a year to see if there's been any changes in their diets. My main points: help a vulnerable population meet health goals to prevent, manage identified health issues, focus on education for prevention and management in line with meeting Healthy People 2020 objectives. My problems encountered were considerable time constraints, procedural policies such as background checks that limited my population, language and educational barriers, keeping my target group focused and engaged, and that there was a loss of cohesiveness because my classes were separated by 2 weeks. It was difficult to meet the time requirements for the course, but also meet with the children in the required times for the facility. Finally, some suggestions for the future would be to have more hands-on activities for the kids, allow more prep time for the student, as well as allowing more time to gain those background checks so that I could have taught at a different facility with maybe a greater population than the one I had. Overall, the experience gave me the opportunity to present information to the public and hopefully plant some seeds in order to allow these children to make good choices regarding nutrition and exercise in order to reduce the number of cases we see of the identified health issues of Santa Maria. With that, here's my list of references. Thank you for listening to my presentation. I hope you found some valuable information to take away.